And as cases trend upward, more people are getting tested for COVID-19 before traveling for the holidays.
But a rapid test can be hard to find, leading many people to turn to at-home tests. News 19's Hunter Drinker joins us live from Star Market on Pratt in Huntsville, where pharmacists say at-home tests are just flying off the shelves.
Yeah, that's right, Greg and Siobhan. When I got here to the Star Market Pharmacy in Huntsville at about 6:30 this evening, they had 2 of these at-home COVID-19 tests on their shelves. But within about 15 minutes, both of those tests had been sold. So if you are able to find an at-home COVID-19 test, it may be a good idea to go ahead and use it before visiting family for the holidays. Testing yourself for COVID-19 at home has its advantages.
It gives you kind of the autonomy to do it on yourself, take it at your own pace. The at-home test is also a little bit less invasive.
The results are ready in about 10 minutes, but it's not quite as reliable as being tested by a healthcare provider.
Doing the at-home test, meaning that it's not done by a medical professional, you may not actually collect a proper sample all the way.
That's why it's important to make sure you follow the instructions carefully. Wash your hands or wear gloves before opening the kit. Make sure not to touch the part of the swab that goes inside your nose. That could contaminate the sample. This particular test requires swabbing each nostril 4 times. Once you've collected the sample, you simply stick it in the testing solution and stir it around. Then you'll let the sample sit in the solution according to the kit's instructions. Next, you'll insert the testing strip into the solution. 10 minutes later, the results are ready. A single blue line shows that the test was successful. If a red line showed up in addition to the blue line, that would mean the test was positive. Health officials say while at-home tests aren't foolproof, they're a good way to screen yourself for the virus, especially if you plan on visiting people who may be especially vulnerable.
So if you have access to at-home testing, it may be a good idea to do that prior to gatherings. In case you are minimally symptomatic but infected, I would not use this as a test if you've been exposed or you have symptoms.
And again, guys, the key phrase there is if you have access to one of these tests. Now, I have to tell you, doing this test earlier today, it was a lot simpler than I expected it to be. But again, they are in high demand right now and short supply. The pharmacists here at Star Market tell me they are working to get more of these tests on the shelves before Christmas. Meanwhile, the Biden administration announced yesterday a plan to ship 500 million at-home COVID-19 tests right to people's front doors, but it's unclear when that program will begin. Live in Huntsville tonight, I'm Hunter Drinkard, News 19.